Acid reflux and heartburn is a common problem, with millions of sufferers worldwide. The standard medical treatment involves prescription medications, such as omeprazole. However, natural treatments can be just as effective. Making some changes to your diet and sleeping patterns could noticeably bring down your symptoms of heartburn and acid reflux, which can make a huge difference to your life. What is acid reflux, and what are the signs and symptoms? Acid reflux happens when your stomach acid gets forced up into the esophagus, the pipe that carries food and drink from the mouth to the stomach and digestive system. A small amount of acid reflux is quite normal, and just a harmless, unpleasant experience, and usually doesn't cause lasting symptoms. However, if it happens too often, it can burn the inside of your esophagus. It is estimated that up to 20% of all people have reflux of some form or another. The most well-known effect of acid reflux is called heartburn, which is an unpleasant and painful burning sensation in either the chest or throat, or both. Out of the people who often suffer heartburn, 25 to 40% will be diagnosed with gastroesophageal reflux disease, GERD, which is the most serious kind of acid reflux, and the most common digestive condition. As well as heartburn, the usual symptoms of acid reflux include an acid-like taste at the rear of the mouth and throat, and problems with swallowing. Additional symptoms can be coughing, asthma, erosion of the teeth, and sinus inflammation. Now I'm going to show you 13 natural ways to calm your acid reflux or heartburn. Number 1. Don't eat too much. At the point where the esophagus leads into the stomach, you can find a circular muscle which is called the lower esophageal sphincter. It has the function of a valve, and its purpose is to prevent stomach acid from traveling up the esophagus. It opens when you swallow, burp, or throw up. At all other times, it should stay shut. When you have acid reflux, this sphincter is weak or not working properly. Acid reflux can also happen when the pressure on this muscle is too great, forcing the stomach acid to squeeze its way through the gap. In pregnant women, a baby can contribute to this pressure. As you would expect, acid reflux symptoms are most likely to happen after you eat, and larger meals can intensify the symptoms. Because of this, one of the best things you can do to help bring down acid reflux is to reduce your portion sizes. Number 2. Lose weight. The diaphragm is a muscle located above your stomach. In healthy folks, the diaphragm strengthens the esophageal sphincter. This round muscle stops your stomach acid from making its way up into your esophagus. But if you're overweight and have too much fat on your belly area, the pressure in your stomach may get to such a level that the esophageal sphincter gets forced up and away from the support of the diaphragm. This situation is called hiatus hernia. Hiatus hernia is the cause of the increased risk of acid reflux and heartburn in obese people and also pregnant women. Countless medical studies have shown that extra fat in the belly area will increase your risk of reflux and GERD. Because of this, if you're overweight, losing weight is going to drastically increase your chances of dealing with your acid reflux. Number 3. Reduce your carbs. There is a growing body of evidence suggesting that low-carb diets can relieve the symptoms of acid reflux. There is suspicion in the scientific world that undigested carbohydrates might be encouraging the overgrowth of bacteria and increased pressure in the abdomen. Some people even think that this could be one of the most frequent causes of acid reflux. Studies have shown that overgrowth of bacteria can be caused by impaired carb digestion and absorption. Having too many unprocessed carbohydrates in your digestive system makes you burpy and bloated. Giving support to this idea, a few studies have actually shown that low-carb diets can bring down acid reflux symptoms. Further studies are needed, but people are already reporting success with this diet change. Number 4. Go easy on the coffee. Studies have shown that coffee can weaken the esophageal sphincter, increasing the risk of acid escaping into the esophagus and causing acid reflux. Evidence points a finger at caffeine as the probable cause, as decaffeinated coffee did not have the same effect as regular coffee in a study. However, in contradiction, another study that gave subjects caffeine in only water could not show any effects by caffeine on acid reflux, despite proper coffee itself showing a bad effect. These studies could imply that components other than caffeine might be contributing to coffee's negative effect on acid reflux. The process and manufacture of the coffee may be the true culprit. Whether coffee intake contributes to acid reflux may depend on you as an individual. You'll have to experiment. If you find that coffee contributes to your heartburn, either cut it out or reduce your consumption. If you find that it doesn't have an effect on you, continue to enjoy your cup. Number 5. Reduce alcohol consumption. Drinking alcohol can increase the acuteness of acid reflux and heartburn symptoms. It worsens the symptoms by increasing the production of stomach acid, relaxing the esophageal sphincter muscle, and stopping the ability of the esophagus to clean itself from acid. It has been shown that even moderate alcohol intake can cause acid reflux symptoms in otherwise healthy subjects. Too much alcohol consumption can increase acid reflux symptoms. If you're feeling heartburn, bringing down your alcohol consumption could help reduce some of the pain. Number 6. Don't eat raw onion. One assessment of acid reflux sufferers demonstrated that eating a meal with raw onion noticeably worsened heartburn, acid reflux, and gassiness, compared to exactly the same meal, but without the onion. Increased burping could imply that more gas is being produced in the stomach because of the high levels of fermentable fiber contained in onions. Raw onions could additionally irritate the coating of the esophagus, which would worsen heartburn also. Experiment with your consumption of onion and see if it worsens your symptoms. If you notice a bad effect, cut it out. Number 7. Start chewing gum. A good quantity of studies have shown that chewing gum can help bring down the acidity in the esophagus. Chewing gums which contain bicarbonate appear to be particularly useful in the battle against acid. Scientific conclusions do indicate that chewing gum, and the raise in saliva production that it brings with it, can do its part in helping to clean the esophagus of excess acids. Number 8. Be careful with citrus juice. A majority of acid reflux patients have reported that grapefruit and orange juice have made their symptoms noticeably worse. This is not just a simple question of acidity in the fruits. Orange juice actually has a neutral pH, but has still been shown to negatively affect symptoms. As the juices don't weaken the esophageal sphincter, it has been concluded that some of its ingredients must irritate the coating of the esophagus. Citrus juices most likely don't cause or start off acid reflux, but they can make your symptoms worse, so think about cutting down on these if you like them. Number 9. Avoid carbonated drinks. Patients with acid reflux and heartburn are often advised to stop drinking carbonated beverages. An association has been shown between gassy soft drinks and the incidence of acid reflux. It has also been shown that high amounts of gas in drinks, including sparkling water and beer, as well as soft drinks and sodas, can weaken the esophageal sphincter compared to consumption of drinks without gas. The cause for this is that the gas increases your burping, which means your esophageal sphincter opens more often, allowing more acid to escape upwards. Number 10. Avoid mint. Mint, both as peppermint or spearmint, is a frequent ingredient in many foods and oral hygiene products like toothpaste and mouthwash, as well as being found in many types of herbal tea. One study, although showing no sign that mint was having any effect on the esophageal sphincter, did show that high doses of mint may increase symptoms of acid reflux, which was assumed to be due to the irritation of the walls of the esophagus. Experiment with mint and see if it has any effects on you. Avoid it if you find it to be having any negative effects on your symptoms. Number 11. Don't eat right before going to bed. If you have acid reflux, it's a good idea to not eat right before bed. In fact, you can try to leave a gap of up to 3 hours before heading off to sleep. Despite this idea being common sense, there is actually not a lot of evidence in its favour. One study of subjects with GERD found that consuming a late night dinner had no impact on symptoms when compared to an earlier dinner. But, in contrast, another experiment discovered that eating right before bedtime was linked to noticeably increased acid reflux symptoms during the night. This could depend on the individual, and is definitely worth you testing for yourself if you are having dinner very late. Number 12. Avoid sleeping on your right side. It has been demonstrated several times that sleeping on your right side can contribute to acid reflux symptoms at night time. It is not clear as to exactly why, but anatomy could provide an answer. The esophagus enters your stomach on the right side. Because of this, the esophageal sphincter is actually above the stomach acid level when you are sleeping on your left side. If you're on your right side, the esophageal sphincter is below the line of stomach acid, which of course increases the chances of acid leaking into the esophagus if the sphincter is weak. Of course, this advice is not entirely practical, as we always change our positions during sleep, but starting off by falling asleep on your left side could help you to get to sleep and provide some symptom relief. In other words, resting on your left side might make you more comfortable as you fall asleep, even though your body will eventually turn during the night, and you can't stop that. Number 13. Sleep in an elevated position. Many people suffer from the symptoms of acid reflux during the night, and this can make it difficult to sleep well, which opens up a whole new set of problems. In response to this problem, a study was done which showed that people who slept in a slightly elevated position had noticeable improvement in their symptoms of acid reflux when compared to those who were sleeping in a standard flat position. On top of this, an analysis of multiple studies showed that bringing up the head of the bed to create an elevated position is an effective method to ease heartburn and reflux at night time.